Welcome to This Explainer. All right, grab your metaphorical magnifying glass, because today we're stepping into the shoes of a medical detective. While modern medicine often relies heavily on blood tests and digital imaging, traditional Chinese medicine, or TCM, leans into a practitioner's own highly refined senses. We're going to explore exactly how listening and smelling operate as incredibly sophisticated, essential diagnostic instruments. So let's kick things off with a bit of a medical mystery. How exactly do practitioners figure out what's happening inside the body of an infant, an unconscious patient, or someone who's entirely nonverbal? I mean, when a patient literally can't tell you where it hurts or describe their symptoms, the practitioner has to become a super observant investigator. And they do this by tuning into the subtle frequencies that the body itself is constantly broadcasting. To answer how they do that, we're going to follow a quick roadmap today. We'll look at the 4 diagnostic pillars: what happens when words fail, the art of listening, the science of smelling, and finally, forming the complete picture.
Section 1. The 4 diagnostic pillars, the holistic framework.
Okay, so TCM relies on 4 primary pillars to gather evidence. You've got looking, which includes examining things like the tongue and a patient's overall vitality. Then there's listening and smelling. After that is asking about patient history. And finally, palpation, like checking the pulse. Today, we're zooming in specifically on that second element, the auditory and olfactory pillar, known in Chinese medicine as Wen-Zhen.
Moving right along to Section 2. When words fail, sensory clues. Now, you might be wondering, when are these specific sensory clues the absolute most critical? Well, they're essential for infants, the elderly, or patients with confusion or speech disturbances. But beyond that, they offer direct readouts for a really broad spectrum of ailments. They act as crucial indicators for acute respiratory disease, gastrointestinal disorders, gynecological damp heat syndromes, and Shen, or emotional disturbances, especially when words just aren't an option.
Section 3. The art of listening, acoustic detectives. All right, let's dive into the auditory side of things. In this system, the quality, rhythm, tone, and clarity of the sounds a patient makes are literally acoustic readouts of their internal organs. According to TCM physiology, the lung controls the voice itself, while the heart controls speech and the Shen, or spirit. Because of these hardwired connections, any disruption in those organs instantly alters the sounds a person produces. So what are we listening for? Well, there's a really stark contrast between the 2 main categories of vocal tone. On one hand, a loud, forceful voice indicates an excess condition and robust Zang-Qi, which is basically the body's healthy, upright energy. On the flip side, a weak, soft voice immediately signals a deficiency condition to the practitioner. It points to a lack of qi, blood, or just poor lung function. It's a rapid auditory binary that instantly points the diagnosis in a specific direction. Let's think about this like a detective profiling a suspect, translating these specific audio clues. If a patient's speech is incoherent, the practitioner immediately suspects a Shen disturbance or heart heat. Stuttering? That points to liver wind or phlegm obstructing the spirit. And you know that heavy sigh we all let out when we're stressed? In TCM, frequent sighing clinically points to liver qi stagnation. Finally, labored breathing with wheezing is a textbook indicator of phlegm retention in the lungs. And it's not just speech. Involuntary sounds are just as telling. A dry cough suggests lung yin deficiency, while belching means stomach qi is rebelling upwards instead of descending like it's supposed to. Borborygmus, yeah, that's just a fancy medical term for a rumbling stomach, indicates spleen qi deficiency or dampness. And this is fascinating. If a child cries loudly and continuously at night, it can actually point a practitioner straight to a heart or kidney imbalance. Let's shift to Section 4, the science of smelling, olfactory evidence. Okay, trading the ears for the nose here. Odors act as vital olfactory evidence. Foul smells generally indicate the presence of heat pathogens, whereas a distinct lack of odor points toward cold or deficiency. Think of it this way. Heat in the body acts a lot like heat in nature. It causes things to overcook, stagnate, or putrefy, which generates strong, foul smells. Conversely, cold or deficiency conditions slow the metabolic processes down, resulting in practically no odor or a very mild smell. The practitioner's nose is basically acting like a highly sensitive chemical analyzer. Foul or sour breath? That clearly indicates stomach heat or food retention. Essentially, digestion is backed up. A strong, rancid, overall body odor is a sign of damp heat or toxic heat circulating in the system. And if a patient has sour, pungent sweat, that points directly to what is called Yang Ming heat. And yes, this detective work absolutely extends to all secretions. A strong burning odor in the urine flags damp heat in the bladder or the lower jowl. Foul, putrid stools signal heat in the intestines. And if a practitioner smells a rotten odor coming from skin wounds, that is a serious clinical sign of toxin, blood stasis, or necrosis.
Bringing it all together now with Section 5, forming the complete picture, integrated diagnosis. So, how does all this incredibly specific sensory data come together in a real clinical setting? Well, the absolutely crucial point here is that listening and smelling are never just isolated parlor tricks. They are deeply integrated into a holistic diagnostic process. You would never, ever make a complete diagnosis based on a single sound or smell alone. It's always a combination of looking, asking, and palpation. These senses ultimately fine-tune the treatment strategies by combining auditory and olfactory clues with visual, verbal, and tactile evidence. They enrich the overall pattern identification, what TCM refers to as beyond zing. The practitioner maps the smell of the breath or the wheeze in the chest directly alongside the coding on the tongue. They weave in the patient's reported medical history, and they check the subtle rhythms of the pulse. Synthesizing all these different clues is what ensures absolute precision in the final treatment. To wrap up our explainer today, I want to leave you with this provocative thought to chew on. What subtle diagnostic clues might your own body be giving away right at this very moment? Next time you find yourself sighing heavily at your desk, clearing a dry cough, or noticing a shift in how you respond to the heat, remember, your body is constantly broadcasting a highly detailed status report. You just have to know how to listen and smell. Thanks for joining me on this explainer, and stay curious.